Hello everyone, I'm John Barboza from Life Enriching Hypnosis, and you are watching Hypnotism 101. Thanks for tuning in. I recently became aware of the passing of a very knowledgeable and talented hypnotist named Ron Esslinger. In fact, the Journal of Hypnotism magazine, which is distributed through the National Guild of Hypnotism, had a full page of Ron's achievements. He was a retired captain of the United States Navy, a registered nurse, anesthetist, an NGH certified instructor and owner of the Healthy Visions Wellness Center in Tennessee. And his specialty was pain management. I've been to a couple of his presentations and workshops, which were filled with an abundance of invaluable information. And so today I'm going to talk a little about the moderate to large pain relieving effects hypnosis has when supporting its use for pain management. I met a woman who was overly fearful of going to a gynecologist for a pap smear, so much so that every time they took her blood pressure, it was extremely high. After a couple of hypnosis sessions and suggestions to remain relaxed and focused on a pleasant memory, she went to her appointment, and to the surprise of the nurse who usually took her blood pressure, the reading was normal. She smiled at the nurse and told her that she was hypnotized to remain calm and relaxed during the visit. While waiting for the doctor to enter the exam room, she remained calm and was actually looking forward to the procedure. When the doctor finally entered the room after looking at the normal blood pressure readings, he surprisingly wondered why she was not the nervous wreck she usually was. And she told him that she was hypnotized to remain calm and that she was going to hypnotize herself before the procedure. He was curious and asked if he could watch her, and she said yes. She closed her eyelids, took a deep breath, and the moment he saw her body physically relax, he began the examination. When it was over, he called her name and she opened her eyes. He was astonished at how relaxed this usually extremely nervous patient of his was, and he told her that she never even flinched. To her surprise, she was even more astonished that the procedure had taken place and was finished, because she didn't remember anything but being in that wonderful, relaxing place in her mind. Another woman who was going for her second dental procedure after the first painful one was unsuccessful decided to get hypnotized in preparation for the dental appointment. This time I accompanied her, hypnotized her in the presence of the doctor and his assistant, and continued giving her positive, soothing, calming suggestions as the dental implant procedure was taking place with no use of lidocaine or pain medicine. When the procedure was over, the assistant was amazed at how clearly she was talking, as opposed to the way patients usually talk after having their mouths numbed with Novocaine or lidocaine. And the doctor who said that this type of procedure, which is usually accompanied with pain, was equivalent to having your nails pulled off of your fingers. To his amazement, he also said that he had never performed this dental procedure without the use of medicine and was even more surprised that there was absolutely no bleeding. When I was in Maryland, I hypnotized a woman who suffered from constant back pain. When she came out of the doctor's office, her eyes were filled with tears and she appeared to be in even more pain than she was in before the appointment. She explained that the doctor was pulling and twisting and pressing and doing whatever the procedure consisted of to her back, which apparently seemed to aggravate the area. After asking her what the level of pain was from the numbers 1 through 10, 10 being the most painful and 1 being the least uncomfortable, she responded with the number 10. In just a few minutes, she was hypnotized, and we were able to consecutively bring the numbers and uncomfortableness down from 10 to a tolerable 2. After opening her eyes, she lifted her arms in front of her and slowly twisted her body from right to left. And to her amazement, she left feeling better than she felt before going to the appointment. Hypnosis, when used for pain management, can be very useful. The point is to help alleviate any type of discomfort, lessening the uncomfortableness so that it's more tolerable to cope with. It's important to never remove the pain completely because we experience pain for a reason. It's our body and mind letting us know that there's something wrong. And if you remove the pain completely, The person may feel as though they are invincible and begin moving furniture or something else, which can re-injure that area even more. I'm John Barboza, and this is Hypnotism 101.